If you've ever suffered with severe stomach discomfort, you may be able to sympathize with those with inflammatory bowel disease, also known as IBD. Over 1.5 million Americans suffer with IBD, a group of disorders in which the intestines become inflamed. One of those disorders is called Crohn's disease, an autoimmune disease of the digestive tract that most often affects the small or large intestines, and sometimes both. Dr. Lilly Tran of Advanced Gastroenterology and Surgery Associates explains how Crohn's disease presents.
Crohn's disease is known, the general term is inflammatory bowel disease, whereas the GI tract, due to immune processes, is inflamed chronically. It is a chronic condition. Under inflammatory bowel disease, there are actually 3 subcategories. Crohn's disease is one, and Crohn's disease can affect anywhere from the mouth, esophagus, stomach, the small bowel, as well as the colon. The other cousin is ulcerative colitis, and ulcerative colitis affects only in the colon. And there's also a name called mixed inflammatory bowel disease, where based on pathology or tissue samples, they cannot differentiate between one or the other. But generally, patients with Crohn's may have abdominal pain. That seems to be the predominant symptom. Bowel change, usually diarrhea, and some people will experience blood, so they may pass bloody stools. Also, anytime when you have bloating, cramping, those are general symptoms as well. The job is to first listen, ask more specific detailed questions, review the labs that have been done already by the primary, and so you try to put the picture together. Then based on the symptoms, what further diagnostic testing will need to be done. Usually by the time patients come to the subspecialist, such as gastroenterologists, basic labs have already been done. So if those are done, if they review an upper GI source, we go down and we do an upper endoscopy. If they review a colon source, then we do the lower endoscopy. But if those are non-specific, then we do further testing. Inevitably, the patients will need some type of endoscopic evaluation.
Crohn's is a lifelong condition which can severely impact a person's ability to fully engage in work or social situations due to symptoms. The exact cause of Crohn's disease is unknown, and the disease is not currently curable, but there are a number of treatments which can help. For more information on Crohn's or other services available at Advanced Gastroenterology and Surgery Associates, please click the Living with Crohn's story link icon on our homepage, yourhometownhealth.com.